Scrupulosity is treated in much the same way that we treat other forms of OCD. One of the biggest challenges, however, is many people with scrupulosity are concerned that the treatment is actually going to harm their religious beliefs or actually going to remove their religion in some way. And what we want to start with is that OCD treatment for scrupulosity at the end will help the person practice their faith in a closer and more joyful way. And so that's a really important place to start. When doing treatment for OCD, it's very important to understand that we're really trying to do exposure to the uncertainty about committing some kind of sinful act or blasphemous act. A lot of people are concerned that the exposure treatment for OCD means that they have to go out and blatantly sin and things of that nature, and because of that they'll refuse treatment altogether. But that's not the intent of exposure therapy for scrupulosity. In fact, we're trying to diminish that fear so that the person with scrupulosity can practice their faith like anybody else of their church or religious group. And so what that might mean is that, let's say they're having concerns about blasphemous thoughts or something of that nature, we'll have them do an imaginal exposure, for example, where they write out the content of the thoughts that they're very worried about and then play it on a loop tape or a loop recording. And so they play it over and over, and it is very scary. The anxiety goes up, but then when they don't neutralize, when they're not trying to undo the thought or praying compulsively or those kind of things, eventually they learn that they can tolerate that anxiety, and in fact that they can go on without having to do those rituals.